Good morning, ladies and gentlemen. My name is Stefan Launer, and on behalf of EHIMA, it is my pleasure to welcome you today to talk about the changing mindset of hearing care. When we look at hearing instruments, the functionality of these devices has significantly evolved over the past 2 decades. Modern hearing instruments are offering many different solutions to help people with hearing losses cope with problems in communication and hearing in daily life. Hearing instruments come in many different shapes and forms and serve multiple purposes to really amplify the sound and provide audibility to the person, to help enrich speech understanding, speech communication and conversation situations throughout multiple different situations in daily life, and to provide a natural sound that allows for a good environmental awareness of what is going on around a hearing impaired person. Hearing instruments also are intelligent systems that can identify the sound scenes, can track what a listener wants to listen to, and can automatically select the optimal functionality in a specific listening situation. So modern hearing instruments are really agents that are intelligent and rather complex in their design. When we look at the devices, then for many years there had been a myth that a high percentage of these devices ends up in the drawer. But from the data logging data that we have available today, we know a lot about the usage time of the hearing instruments, and we know how the usage and wearing time of hearing instruments has changed over different generations of hearing instruments. So thanks to data logging in our devices, we know that modern hearing instruments are worn for a great part of the day, more than 11 hours per day, and that this average wearing time has significantly increased over the past 2 decades. That the number of devices that are not worn, so for example less than 2 hours on average per day, has significantly decreased, and that situational use has also decreased and continuous use has significantly increased. So one of the big myths about hearing instruments, that they mostly end in a drawer, is simply not true. From the millions of data logging recordings that we have available now, we know that modern hearing instruments are worn, and rarely end up in a drawer, which speaks for the performance and the benefit people get from using these devices. Also, when we look at how satisfied people are with their hearing instruments, from the Eurotrack study that was also conducted by EHIMA, we know that hearing impaired people using the devices are very satisfied and get a lot of benefit from the devices. From conversations with a single person, conversations with family members, outdoors, when talking to children, across to many different situations in daily life, when being in a car, when doing grocery shoppings. So in multiple situations of daily living, activities of daily living, hearing impaired people are satisfied today with the performance of their hearing instruments. That has also changed over the years quite significantly. So we see here how hearing instruments have impacted the quality of life of people, and how hearing instruments provide not only a person with the ability to communicate more effectively, but also give people a sense of safety, allow them to participate in group activities, change social life, change the confidence in oneself. So hearing instruments give a much broader benefit to quality of life than just enabling a person to follow conversations again. That speaks for the importance and relevance of hearing as a sense, which often is a little bit neglected and not considered important enough. Hearing is basically our social glue, and hearing connects us to people and allows us to socially participate and have a socially active lifestyle. And that is a very important fact that we should consider. And hearing impaired people, when using hearing instruments, clearly perceive this benefit of hearing instruments. So when we look at the benefit of hearing care, of hearing aids, then we see that hearing aids restore or rehabilitate the basic sense of hearing and provide audibility. In doing so, they also allow people to join communications in daily life. They provide speech intelligibility to hearing impaired people again. However, these two basic factors of hearing have a much broader impact, as I said, on quality of life. When people are able to follow a conversation again, typically that reduces the effort, it reduces the fatigue people experience in communication situations. And it takes quite a bit of anxiety away that keeps people from joining social lifestyles. Next, when using hearing instruments in conversation situations, it reduces the cognitive load. So it allows them to really attend more to the content, to focus. It allows to memorize things much more. And it has a positive impact on cognitive health, which I will discuss soon on the next slides. Finally, hearing instruments allow to socially integrate, to socially participate, to lead an active social lifestyle. And we even have evidence showing that hearing instruments increase physical activity of hearing impaired people again when starting using the devices. So overall, hearing instruments foster a healthy living and a healthy lifestyle in an elderly population. So broadly speaking, we have to change our mindset about hearing care, and we have to expand our mindset. Healthy hearing has a much broader impact on healthy living than has been considered in the past. Healthy hearing has a very positive impact on social emotional health, on physical health, and also on cognitive health. It increases or reduces the listening effort, reduces fatigue, it reduces social withdrawal and social isolation. It improves physical activity and improves activities of daily living. And as I already mentioned before, it potentially reduces the risk of cognitive decline. And that's a topic I will discuss in the next slide. There has been a lot of evidence discussing and talking about the importance of hearing loss on dementia, the impact of hearing loss on dementia, and the potential impact of hearing care, hearing rehabilitation on reducing the risk of cognitive decline and dementia in particular. There has been a lot of studies that have shown positive evidence, but most of these studies were retrospective and cross-sectional and not controlled, randomized controlled trials. So one could criticize the study design and with that the reliability of the results. However, last September in The Lancet, a study was published of the so-called ACHIEVE trial, which was a trial including nearly 1,000 study participants in 2 arms, or actually 3 arms, and based on the evidence of this ACHIEVE study, which was led by the Johns Hopkins University in the US in Baltimore. Based on the evidence of this study, hearing loss might be a particularly important global public health target for dementia prevention efforts. In this study, in a randomized controlled trial with a large study population, it was shown that people using hearing instruments, especially in a group at risk of cognitive decline, had significantly improved cognitive health in a 3-year time window. So they performed better on cognitive tasks than a control group not receiving hearing instruments, which is a very positive and encouraging result. A similar study has been conducted in Australia with very similar results that also has been published very recently. Extending on cognitive health, we also have strong evidence that shows how hearing aids reduce daily fatigue, and increase social activity, so lead to people being more active, going more out and participating more actively in social lives. Next, we also have some evidence that clearly shows that when people start using hearing instruments, they start doing more activities in daily living, and with that also be physically more active, potentially have more steps, go more to exercise classes and things like that. So overall, what we see from this research is that we have to extend the mindset, we have to change our mindset and put hearing care into a broader context. When we look at hearing aids, they have come a long way in terms of functionality, performance, and adoption. Modern hearing instruments provide significant benefit in daily life communication situations. But beyond that, we also have shown that hearing care can have a very positive impact on other considerations of health, such as socio-emotional health, cognitive health, and physical health. So they can have and foster a more active and healthy lifestyle and a more healthy living in an elderly target population. That requires us to rethink how we can embed hearing care more broadly and take a more interprofessional approach to healthy living and aging, where we can connect people looking after hearing audiologists, or we can connect them more with other healthcare professionals such as geriatricians, GPs, also neurologists, and so on and so forth, to better address the needs of an elderly target population from a more holistic perspective. Furthermore, when we think about technology and technology convergence, we see the integration of more and more health sensors in devices worn at the ear. So the question is whether sooner or later hearing instruments will include more health monitoring functionalities, and with that not only provide benefit for hearing, but also turn and morph into health agents. Thank you very much for listening, and I'm very open to questions and discussions. Thank you.